In the brain, the respiratory system has neurotransmitters that move across the synapses to send the message for the person to breathe. At this point, a person can breathe normally. When an opiate drug like fentanyl or heroin enters the body, it moves to the synapses and blocks the normal neurotransmitters. The person now gets weak and goes unconscious and appears to be asleep. Other signs of an opiate overdose include pinpoint pupils, pale, dull skin, limpness, lack of response to painful stimulus, breathing sounds like snoring or gurgling and then stops. Shortly after that, the heart will stop beating and the person will die within a few minutes. When naloxone, or commonly known by its trade name Narcan, enters the bloodstream, it goes to the respiratory center in the brain and pushes the opiates off the synapses and allows the normal neurotransmitters to pass through and the person starts to breathe again. Time is critical. Here's what to do. Number 1. Determine the opiate overdose by shouting and shaking the person and try and wake them up. Number 2. Call for help and have someone call 911. Number 3. If Narcan is available, open the package, remove the device, tilt the patient's head back, insert the tip into the patient's nostril, press fingers right up against the nose, and push the plunger with your thumb. Each device gives a single dose. Narcan can be given every 2 to 3 minutes. If the person has not had an overdose, giving Narcan will not hurt them. So if in doubt, administer Narcan. Number 4. Monitor the person. If the person is still not breathing, perform rescue breathing or start CPR if the person does not have a pulse. If the person starts to breathe, roll them into the recovery position. Number 5. Wait for 911 responders.